Hi everyone, my name is Hannah Collins. I'm an honors college student with an exercise science major, and I completed a surf grant project this summer. The title of my surf grant project is Comparison of Lower Extremity Jump Landing Biomechanics After Anterior Cruciate Ligament Reconstruction with Quadriceps Tendon versus Patellar Tendon Autografts. Lower extremity injuries, including the leg, ankle, and foot, make up 66% of all sports-related injuries, with the knee being the most commonly injured joint. Of these common knee joint injuries is the devastating rupture of the anterior cruciate ligament, also referred to as the ACL. In the United States alone, approximately 100,000 to 250,000 ACL injuries occur annually, with roughly 125,000 of them requiring ACL surgery. Despite surgical and rehabilitation strategies, we still see persistent disabilities and public health concerns such as obesity and decreased physical activity levels. I'm going to direct your attention to the right-hand side of the screen to the anatomical picture of the knee. The ACL is often surgically treated with a long-standing technique taking tissue from below the kneecap, known as the patellar tendon, but a newer technique taking tissue from above the kneecap from the front thigh muscles, known as a quadriceps tendon, is gaining in popularity as an alternative surgical approach. Preliminary evidence from muscular strength outcomes and movement analysis suggests that the quadriceps tendon is at least as good as the patellar tendon when it comes to restoring function. The purpose of the study was to compare the biomechanics of a drop vertical jump landing task among ACL surgical patients reconstructed with quadriceps tendon grafts and patellar tendon grafts. It was hypothesized that there would be no significant differences between the patellar tendon and the quadriceps tendon groups in hip and knee sagittal plane peak joint angles, peak joint forces, and vertical ground reaction forces. 24 individuals, both male and female, gave informed consent and completed the study. Of these 24 individuals, 10 of them had surgery with the patellar tendon graft and 14 of them with the quadriceps tendon graft. All participants were screened in order to establish inclusion and exclusion criteria as seen under this method section. The participants completed a drop vertical jump landing task in a biomechanics lab, and this is represented by the skeleton picture. The drop vertical jump landing task consisted of dropping from a 20-centimeter box and landing onto a treadmill with two separate force plates on it, one on each side. Participants were told to land with one foot on each force plate, and upon landing, immediately perform a maximal vertical jump. Here in the upper right-hand corner of the screen is a graph representing vertical ground reaction forces, and it's the vertical ground reaction force over time during this task. On the x-axis is time in milliseconds, and on the y-axis is vertical force. Here on the horizontal part of this graph is when the participant is still standing still in the box prior to completing the task. Then we see as they step off of the box and they are in the flight phase, the vertical force drops to 0. 0 force means no weight on the force plates. Vertical force increases again to this first peak, which represents the initial landing phase after the flight. And as they transition from their first landing phase to their second flight phase, vertical force returns to 0. And that is their second jump. And when they finish their vertical jump, they have a second landing phase, which is represented by the second peak. There are two separate landing peaks on this graph, but for the purpose of this study, we only took our data points from the initial landing as represented by this green box. In the bottom right graph is the kinematics data. The yellow line represents the total amount of hip flexion or bending at the hip, and the red line represents the total amount of knee flexion or bending of the knee. The green box is seen in both graphs, and in the top graph, it particularly represents the initial contact of the participant with the force plate, and in the bottom graph, it represents peak flexion angles. In other words, the green box in the study and on these graphs represents the deceleration phase of the drop, vertical, jump, landing task. We analyze these data points with a non-parametric t-test to compare groups due to our lower sample size. Table 1 shows that we examined participant demographics to ensure that our groups were similar, and they were, and that's indicated by no statistically significant differences between our groups. Our measurements of knee flexion, hip flexion, and peak vertical ground reaction force represented symmetry between limbs. In evaluating these data points, we used limb symmetry indexes, or LSI, to see if there was symmetry between the surgical limb and the non-surgical limb during the landing phase. Based on our results from Table 2, as seen here, there were no statistically significant differences between our groups as it pertained to limb symmetry. For the discussion, in previous research, we have seen, and it has showed, that altered movement patterns persist following anterior cruciate ligament surgery despite the restoration of knee joint stability. Our hypothesis was that there would be no significant differences between the quadriceps tendon and the patellar tendon when it came to these movement patterns, and our results demonstrate that this was correct. The measurements we examined, as seen in Table 2, are important to clinicians as they relate to restoring normal lower extremity movement patterns and making decisions about return to sports and return to physical activity. A limitation of our study, though, is that our participants are only 6 months to 2 years out from surgery. So we say that this data should be taken with caution, and more research is needed in order to examine these same outcomes, but in a larger participant pool of data and in a longer time of follow-up after surgery. Based on these results of our study, we determined participants receiving quadriceps tendon and patellar tendon grafts demonstrate similar landing techniques and patterns for knee and hip movement and lower extremity force absorption. In conclusion, the quadriceps tendon graft may be a viable alternate graft when it comes to ACL injured patients.